I'm Dr. Jordin Wiggins, and this is the Pleasure Principles podcast. Join me on this journey where sex, science, and sensuality meet. Let's change the conversation around sex and pleasure together. For those of you that have read my book, The Pink Canary, you already know that lack of pleasure is a health problem. This week on the Pleasure Principles podcast, we are going to be talking about health. Welcome to the first episode of the Better Health series. We cannot talk about sex and pleasure without talking about our health because they are so intertwined and connected to part of our identity, our physical, emotional experience, especially as women. Women's health is one of my favorite topics. It's near and dear to my heart as a naturopathic doctor and advocate for women's health. In fact, opening my own women's health clinic called Health Overall at 27 years old was how I got my start into the pleasure doctor that you see before you today. If your health is starting to be affected by the overwhelm, the stress, the lack of rest, the lack of pleasure that we talk about regularly on this podcast, if you are a burnt out superwoman, I'm talking to you, you are probably experiencing fatigue or not as much energy as you wish you had, brain fog, sleep troubles, difficulty getting out of bed in the morning, lacking motivation and creativity, low libido, that afternoon crash that has you reaching for the latte or a sugary snack. Maybe you're gaining weight around your middle that's really hard to get off. Does this sound like you? If so, keep listening. I call this feminine burnout. A particular type of fatigue and burnout reserved for you, type A, overachieving perfectionists that is a result of the patterns and conditioning placed on us as women that puts the focus of our lives on others. How can we earn the love and respect of our partners, bosses, and employees by being everything to everyone and not on the pleasure, desires, and needs we really need to fulfill our lives as the full, bright, beautiful, connected experience we deserve? And unchecked, this conditioning impacts our libidos, health, mental health, and relationships. This series is focusing specifically on women's health, how the years of burnout and lack of support from the healthcare system and those around us have led to a generation of women who are unhappy and unhealthy. And we're talking about where we need to go to find the answers that are going to help us collectively feel better. Because right now, the system that we are trying to access is not working. I want for all of you better health, better sex, and more wealth. And these conversations are the first step in how we get there. Today on the podcast, I'm speaking with Dr. Chelsea Pretty, a medical doctor working to change the dynamic that is holding women back from living their healthiest lives. We talk about how we met, some of the problems that we're seeing pandemic related, some of the problems that we're seeing women getting access to the care that they need, and what we can do about it. I hope you enjoy. I'm here with Dr. Chelsea Pretty. We have known each other since 2002?
2006, I think.
Okay.
But it's getting close. It's like 15.
So we met in doing our pre-med degrees, and I was trying to think the first time I met you, and I think it was Med Plus.
I think so too. I was trying to think about that too. And I think it was Med Plus, and I kind of remember, I don't know if they still have this at Brock anymore, but we had to do this like trust activity on like a Saturday or something at the beginning of
Yes.
university. And there was like these tight ropes and hanging monkey bars. And I like, it's one of those things that I didn't really remember until I was trying to think about when we actually met.
I know, same, but I definitely think our first, like aside from being in the same undergraduate
Like
program, I
classes.
think our first interaction was probably Med Plus. And I was thinking back, and I remember when they were teaching us how to introduce ourselves to people and like shake hands and stuff. And that was the one that sort of stuck out in my mind because I was
Yeah.
like, I'm in the wrong room.
Yeah, I remember like that first year, we were so young and they were doing like practice interview type of things and just thinking this world is crazy, which it is.
It is. And then speaking of crazy, so we did the same undergrad, took different career paths. You
Mhm.
the medical route, me the naturopathic functional medicine route. And now we've like our paths have crossed again, which is so beautiful. And we will get to that a little bit
Mhm.
later. But I want to cover basically how our healthcare system is failing women. And okay, let me back up. So I think just there's some inherent bias. Like people believe that just because I'm a naturopathic doctor, you're a medical doctor, that, you know, we can't get along or it's very oppositional. Would
It's
you agree?
so, I would say that because when I mention you, because it's so
Yeah,
our
tell me the behind the scenes.
yeah. So when I mentioned like, oh, like I have this friend who I went to undergrad with, and then we kind of like went in different paths, but like we used to see each other a little bit every now and
Yeah,
again when we
even
were
in
living in the same,
Toronto.
yeah, in
Yeah.
Toronto. Um, but when I mentioned like I have a friend that's in naturopathic medicine, it's like, whoa, that must be so weird. Well, no. And I think that is getting better as we're learning that there's different ways of looking at health. And then also too, like I think at certain times your profession gets a little bit of a bad rap in some ways because there's people who are like you who are licensed professionals and regulated by a college, and there's lots of natural health practitioners out there who are not necessarily um, with that level of training. And I think knowing who you're actually seeing is really important, and who you're discussing those cases with are really important as well.
That's a good point. And I forget that because oftentimes the way I feel like my profession is treated is if we don't have any education or a licensing
Right.
body or didn't have to do the same like style of education and OSCE exams. Like, so
Yeah.
and it's a good reminder for me because there are so many unregulated
Like holistic health.
alternative
Yeah.
for sure. And they did not go through the same type of rigorous
Yeah.
post-secondary
Training.
education.
Yeah.
Yeah, because it's 8 years, and then by the time you do your extra stuff, it's like 10
Yeah. Which is,
for to become a naturopathic doctor. So you're not
yeah.
just like, oh, I took this online course and
And now I'll tell you what supplements you should take. And yeah, like
yes,
there's a like a whole process to what you do.
which when we talk about how we can better work together, I think physicians knowing how and who to refer
Hmm.
to would make a really big difference in helping everyone. So
Yeah,
okay,
I agree.
so I do want to say that I love medical doctors. They're very, very brilliant, well-intentioned people that are really, really good at treating many healthcare concerns that we as
Mm-hmm.
naturopathic doctors are not.
Mm-hmm. Yeah.
And vice versa, I think.
Yeah.
I think there's
Yeah.
certain things. What do you think?
I think so too. Like, I think when we talk a lot about the stuff that we see in healthcare, more so now than we probably did 10 and 20 years ago, like talking about like chronic disease type of stuff or mental health types of things, like when you look at how like the structure is in like primary care, and I should say too, like I've only ever really worked in Ontario, so I don't really know how other places work, and this may be different, but in a lot of places in Ontario, like we have kind of the family health team approach, and there's the medical doctors, and sometimes there's dietitians, and sometimes there's social workers, and there's all these like different pieces of people that look at things in their niche area. And sure, like I think we are getting better from like a healthcare standpoint of doing like interprofessional case conferences and stuff, like and especially this is something that it happens like in particularly more in hospital care, but I think we're starting to see this more in like primary care as well. But it's hard to get access to that, because like if you look at some family health teams that I work in, they would maybe have like a dietitian a half day a week, let's say, or something like that. And when you really have somebody who's struggling with like lifestyle interventions, and there's nobody that's like can step back and look at the whole piece, I think that's where kind of the working together piece could have a really big impact in what we're seeing now.
Or
Does that make sense?
better patient care, definitely. And that's
Yeah.
what we excel at. And
Mm-hmm.
so, and that was something very interesting for me when I first opened Health Overall, and I had these ideals of how myself and other practitioners were all going to work together. And then we had structured meeting times to meet and talk about cases, but then that works really well. People are getting better. They're telling everyone. And then your client list is full, your associates list is full. And to really operate and run an integrative care practice, you need the time and resources to do it. So when we are busy and we know, right, especially in Ontario, that our medical doctors are extremely overworked.
Yeah.
Most probably burnt out.
Yeah.
And I'll ask you to speak to that in a second, but I think with the pandemic, there was cracks in the system already that made it hard to provide this certain type of care that you might want in the time to make those referrals and know who to refer to. But I feel like since the pandemic, with the restrictions and all of the extra stuff we have going on, all of the other regulations that we need to abide by as physicians, and I think things are changing, like at least in the outside world. I'm not sure about like hospital and long-term care still seems to be in the pandemic stuff. But do you think the pandemic's made it harder for doctors, like quality of life, burnout? What do you think?
I do. I think I think we've seen, and I think this isn't just your physicians, but we've also seen that like on the news, like the mass exodus of nurses from healthcare in general, because the burnout is so high right now, because the like hospitals were already running at like fairly max capacity with our old aging population, and all of the chronic diseases and stuff that comes with it that brings people into hospital. And then you add this other thing that is like putting people in hospital and bringing people to the emergency department, but then also making it so that your job is a very different place to do. And then two, like people have kids and they're, maybe having to homeschool their kids at home, or their kids got sick and now they're in isolation, and now there's requests for, hey, can you come and fill my shift because I'm, and so on. And it just makes it so that the system was already really stressed. And then it's just added that level. And I think like the burnout piece it's been going on for a long time. Like I remember, it's hard to believe, but when I started medical school, which was almost 10 years ago now, we talked about burnout.
We're getting like I
know
feel like we're getting old, but I still feel like, we were going to St. Patty's Day at Isaac's pub, like.
Yeah, I don't think I can do that anymore.
I could. I mean, not with the 21-year-olds, but I've been craving to like go out dancing and or drinking since we've been locked up.
Yes,
but yes, at like a different location. Mm-hmm. Okay, so sorry, back to burnout, physician burnout.
Yeah. So anyway, so burnout was something that we talked about in school, and I remember too, like we had this extra thing that we could do on mindfulness in medicine, and I remember signing up to do that because I'm always like have always been a higher strung, higher stress person. I was like, oh, that's a really good thing for me, but I think the way we've tried, or at least at that time, I think these are things that have been continually getting better in medical education, is that I remember going to these things after I sat in class for 8 hours, and all you can think about is the tests and stuff that you have to go and write and study for and those types of things. So I think that
when I think back to school, undergrad and naturopathic medical school, I was the most unhealthy that I had ever been in my entire life.
Yes.
Because of the system, like the education system, the way that's set up. I don't know if you feel that way.
Oh yeah. Like I was definitely like, I remember trying to really focus on like making sure that I got my exercise in, and I remember going to this yoga class like at A Good Life in Toronto that was supposed to be more like peaceful, and most of the time I would just fall asleep in the meditation part at the end, and just like, oh yeah, okay. I just took a quick nap, I guess in this yoga class because I was so tired from school. But yeah, it's definitely something that I think they're working towards fixing and bringing more light to that. But yeah, I was definitely not in a good, I would do all the things that I should do, but it was just like in such a high strung state that I don't think it was very healthy.
And so from undergrad for sure, and doing a pre-med degree, and you know what, naturopathic medicine was not any better. It might have even been worse for us to like, try and prove ourselves and the level of our education and how many hours of class and stuff they could cram in a week. They've changed that for the better because they've realized like the mental health impacts and all this other stuff. But like we're always on studying, volunteering, maybe working a part-time job. There's always more to learn or doing
more
better.
To do to get that application looking better.
And then you get into med school, and then there's this whole other level of, competition. Almost like the more you sacrifice, the more burnt out you are, the more stressed out you are. It's almost this, badge of honor.
And and I think like there's definitely been things that have improved. Like when I remember when we started in medical school, like everything was pass fail. Like you knew what your mark was, but it was pass fail. And I think previous to that, there was like a gold level and then pass and fail. But then they subsequently got, I can't remember what it was called, but whatever was the higher level was removed, because like it just breeds this extra amount of competition, because like people who go into medicine or naturopathic medicine are generally more type A individuals and competitive, and they want to do well at things. So yeah, I think like there's definitely things that are getting better. There's definitely it is a path that does lead to burnout for sure.
So then we have a stress system. We have physicians that are stressed, and not because they aren't, well-intentioned, just because of the way that the system is set up. And this is something that I also realized opening a business. And that was another time that I was extremely, extremely unhealthy, because my focus was just do, go, looking at like, P&L statements for the first time and hiring people.
Yeah. All of those business things that they don't really teach you, but are necessary for your life.
Right. So it's like, okay, so I went to school to become a doctor, but now actually that's like a piece of what I do, because in order to do that and do what I love, I have to run a business first and foremost.
Yeah.
And it was things like, crap, we're out of toilet paper, or like the light bulbs are not working in the treatment rooms, like just random things that are extremely, extremely
it just
stressful.
adds to the whole thing for sure.
So we're overworking, we're not prioritizing rest. And then it's almost like I have medical doctors whisper to me in secret. It's like they make their appointment or like want to work with me in shame. It's like a whisper. It's like everything you're saying is about me.
Yeah.
But because I'm a naturopath and they're a medical doctor, it's like they feel like they're this, like going into
like
this
cheating on the system.
Yeah, definitely. What do you think made it okay, like for us to reconnect and you to trust me and know that I wasn't like a witch making potions in a cauldron?
Oh, that's a great question. I think because I knew you, because I had been like intermittently so like part of your journey along the way, like like knowing what you went through in naturopathic school. And then too, like I think it was when I was on maternity leave and your book came out, and I was like, oh, Jordin wrote a book. I was like, that's so awesome. And then I read your book and I was like, yeah, all this stuff that she's talking about with like stress and burnout, and like when you talk about like monkey mind and stuff like that in part of your book, I'm like, oh yeah, that's totally me, and has been for years and decades without me necessarily recognizing it. And I think too, like probably why you're starting to see more of that coming into your world is like we know like burnout is super high in physicians right now, and like I said, in healthcare in general. And like I think at least in Ontario, the medical association and stuff is like putting more into physician wellness, especially for women too, because I think there's a significant higher rate of burnout in women physicians and higher rates of suicide and stuff, which it sucks when you get to that point where you're like, I worked so hard for this and this is really hard. And that I think it's hard to get to the point where you're like, oh, I need to do something about how I operate and how I think.
And to not have the tools in your toolkit to know what it
Yeah.
is.
Right.
Um,
Because I think, and that kind of gets back to like, I think they were trying to teach us in medical school, but I was just like not in a place to be able to receive that information. Like, yeah, like go meditate. And you're like, I have 8 tests to study for this week
no,
in the
exactly.
assignment.
The system, the way that it was set up is there wasn't time for that. There wasn't enough space for it.
Yeah.
Or, I mean, I often wonder, like, if I could go back and do it again, knowing what I know now, would it be
Would
different?
you? Yeah.
But let's talk about because this is with female physicians, especially, I do feel like it's harder for them in ways, in part because of, the invisible workload. So they're working
Mm-hmm.
outside of the home. Sometimes they're the higher earner in their relationship, but then there's also tasks that they can do, like, say, maybe breastfeeding when they have the kids or when they have
Yeah.
children, but also cooking, cleaning,
Mm-hmm.
all of the organizational tasks that the stereotypical more female roles. So I find that it's like women end up doing a lot of both, and then they're
Yeah.
spread so thin that it leads to burnout. What do you think?
Yeah, I think that there's certainly like an aspect to that too. And I think part of it too is probably like a societal thing where it's harder to delegate those things because you want to do them because that's what you saw growing up as being like what you wanted to do as part of your role. Or also to just being that person who doesn't like to relinquish control and just be like, I got everything. And asking for help is difficult for people who are high achievers and stress addicts to do. But
Yes.
it's
So
but it's
hands up,
necessary.
all the like doctors and professionals. and,
Yeah.
um, and you're right. And then to finally, it's like that you work so hard to achieve this outcome and this goal, and you think, okay, when I'm going to get there, it's going to be easy, or I can
Hmm.
relax, or I'll do my meditation once I have my degree.
Yeah. And I think for me, a lot of that kind of stuff came up for me when I was on maternity leave in the pandemic, because there was so much of me that was like, go, 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 go. And yeah, I'll do that once I finish medical school, once I finish residency, once I start working, I will make time for this, this, and this. And then being on maternity leave in the pandemic, like at the beginning when we're basically going to the grocery store like once every week or two kind of thing, because everything was so locked down and don't leave your home and stuff like that, that it was like, whoa, where's my identity outside of my job? Because I just had to try and keep like filling my plate in with stuff, because that's what I would do, like just mindlessly do things during the day. And it's because we don't know how to be, and we don't know how to relax because we just keep going. And I think that's the real big driver of the burnout, is that we just keep going, like physicians, nurses, like. And I think too, like there's a certain parts about like, we're healthcare professionals, we want to help people, like, when people are getting called in for extra shifts because they know that and they feel bad because they know if they don't show up then, or to do this extra shift, that their colleagues are going to be suffering and their friend, like it's all these things when you're a person who provides an essential service for other humans. Like I
And
think
caring people,
yes, because at the
caring,
heart of
high
it, like
achieving people.
we're carrying high achieving people that want to help. But I think too, we're always thinking, and I'm sure this probably comes up in naturopathic school too, but like the first do no harm. And one of the things that I've been trying to think about too is that also applies to ourselves. So if we keep like doing this and burning ourselves out, like who are we going to be serving in the end? When, like, how effective are you when you are like a burnt out, frazzled human trying to help another person in need? And I think that part of it, and just learning that we need to be able to set back and take care of ourselves so that we can take care of other people, is really important.
It is so important. We talk all the time that we cannot pour from an empty cup.
Mm-hmm.
And when you are
Yeah.
burnt out, you have nothing left in the tank.
Yes.
Not for you. You're like snippy, you're miserable, you're questioning like why. Maybe you're just so stuck. It's like one foot in front of the other. And, you know, you're like, if I stop, my whole world's going to crumble. So you just want to keep going, like all of those signs of burnout. But yeah, physicians need people to care for them too, especially our physicians, right? You need a like care team to keep you well-oiled, functioning, amazing, in order for you to go and do your job at max capacity. I tell my sometimes I get asked, like, even with like naturopathic care or coaching or whatever, people are like, I could get a naturopath for half the money as you. And I'm like, true. Yes, you can. But you don't want me seeing that number of patients at that volume. Like, you want me at my best so I can do my best for you. And, you know, and this is different because this is like, that's private healthcare. So there are some like a little more nuances to it. But when I was back to back, saw patients nonstop, and you're just like putting out one fire after another, that was not me providing the best care. And I think healthy.
No. And I think, you know, we've seen shifts in things that have grown, because like back in, like, let's say the 1990s and earlier, doctors were more fee for service. So, which is probably how you guys operate in private healthcare, where it's like, in order for you to, you know, pay off your debt, get groceries, like live your life, you have to see as many people as you can, because that's how you make money. And I think like now we've seen shifts to like more salaried positions and stuff like that. And I was actually seeing this post because today when we're recording this, which just seems like really great timing, is that it's Canadian Women's Physician Day. So happy that day to you.
Canadian Women Physicians Day. How fitting.
How fitting.
If you've been searching for answers for why you don't feel well, why your libido is low, why you feel burnt out and overworked, you're snappy and irritated, you're definitely not alone. You've been told your blood work is normal, you just have to live with it, but you've never found something that works for you and your lifestyle. Maybe your relationship is on the brink of divorce, or you're missing the days of connection and intimacy you once had. If there have been gaps in the treatment that you are getting and the information you've been given about your libido, connection, joy, and how to live a fulfilled, happy life with a ton of energy, then this course is for you. The Pleasure Principles is an online hybrid program that uses self-study combined with bi-weekly coaching directly with me, Dr. Jordin Wiggins, a naturopathic doctor and sexual health disruptor, designed to unlock the barriers that have been holding you back from the life you know is possible. From updated sexual health information to mindset and stress reset to uncovering your desires and understanding what you really want out of life, the Pleasure Principles uses a combination of evidence-based practice, my years of experience working with thousands of women just like you, Eastern medicine theories, and practical everyday ways to apply the work to see real change in your life and relationships. Get the information and the support you need to repair your relationships, start having great sex, and start enjoying your life again. Revolutionize the way you think about pleasure with the Pleasure Principles. Click the link in the show notes or visit my page on Instagram at Dr. Jordin Wiggins to learn more. Do you think that because you knew me in pre-med and you knew that like I wasn't a complete quack, that I was smart,
Yeah.
that I wrote my book and it was like linking the medical and the naturopathic kind of pieces together, bridging that gap? But do you think that like initial trust in me from
Oh yeah, for sure.
helped?
Yes, 100%.
Yeah, because I know more when I've had personal interactions with
Yep.
physicians, and then they know that I have like an understanding of physiology and anatomy and,
Yeah. Yeah. Like I know that you
biochem.
and I had the same like background going in. And I knew like you did did work and stuff and went to school and learned all these things that you
Yeah.
did.
Yeah. So I
I
think
think
that a
that's
little bit of trust too. So we need to help. We need to link. We need to get some trust, but on
yeah.
both sides, I think.
Yeah.
Definitely trust in the naturopathic profession and, separating us from other less qualified alternative
Mhm.
healthcare providers.
Yes. I
So
think that makes sense. Yeah.
okay, so we were talking about
Oh, we were talking about International Women's Physician
Day, yeah, and
Day.
you had a point about that. If you can't remember it, it's probably
It was just a post that somebody, I think she was a female surgeon, who posted something about how like in her time in practice, she's seen so much evolution in terms of like the equality in the amount of men and women in surgery, which I think like traditionally has been much more male dominated. And so I think that's really cool and shows that. But one of the things that she mentioned, and I guess I don't really see this as much because I don't really, because I work in primary care, I don't really get people referred to me. But one of the things was that more often than not, female physicians will get the more psychosocially complex patients or the patients that tend to take more time. And I think now that we're having more conversations about that, I think this is what's really going to push things forward for the healthcare system for the better. Because like there's been studies that have come out in the past couple of years about how traditionally women will spend more time with patients, which doesn't really fit into a model where you're
then you're set up to
for,
make less money.
yeah. And I think that's kind of across the board in Canada, is that like women physicians are almost always making less money than male physicians. Part of that could be part of that timepiece, but then also too, like, because we're also self-employed, like maternity leave, and not even just maternity leave, is like when you're pregnant, you may need to take time off for medical stuff, or, even just to go to your ultrasound appointments and stuff, which is like men will never have to do all of those things. And I think everybody should be entitled, like men and women should be able to take parental leave at whatever point that they are needing to do that. Just there's things that are inherently different. And I think we're having more conversations about parental leave, because I think in Ontario you can apply for 16 weeks, but if you have other positions like where you're paying into whatever union stuff, you can get up to 18 months of maternity leave in Ontario in some places, and that's hard to come back early from maternity leave if you're not necessarily ready, but you have to. Like that's hard.
Definitely. And then I think of, I mean, I had like a month off. I think of
Yeah,
the women in the US that have like
that are,
6 weeks. But
and
yeah,
I can't even imagine what that would
that's
be, what that would be like.
Talking about, yeah, the patriarchal, misogynistic kind of society where we're setting women up to have less wealth, worse health, be more burnt out. Yeah, I completely agree. And I think that, and that's why I created a different model of care, because the traditional naturopathic model, which was fee for service, I was like, this is bullshit. This does not work for me because I am hypocritical. I am burning out because of the amount that I'm working. Like, I don't feel an integrity at all when I'm speaking to women about how to care for themselves, their health, how to like have hormone balance in
like giving self-care prescriptions that you don't follow yourself, and you just
right. I was like, something's wrong here. Like, this doesn't feel good to me. So, but then it came back to even like, so many evolutions and then ingenuity of care and just creating a different model, which was like, what do I want for me, for my daughter, for my friends? Like, what would be the ideal healthcare that I could provide? And how can I provide it in a way that people can access it, which should be a completely different podcast on different models of care. But let's talk about medical gender bias, and then we will talk about like the future and how we can work together. So for those listening, medical gender bias is how we are treating males and females differently in healthcare. And this is something that has improved a lot, but traditionally, just give a few examples, because, not everyone had exams on this like we did. But so for example, there was a massive study done, I think in the early 80s, on aspirin and heart disease. And it was just men. It was like the physician something. I can't remember the name of the trial. Anyways, if anyone needs to know that, just message me and I will find it for you, but it's not coming to me. Women present differently when they have a heart attack is another very common example. So a lot of that was getting undiagnosed. I believe now they're teaching that, right?
Yes.
In school, for sure. To be able to recognize that sooner. But for a lot of years, it wasn't getting picked up on because doctors weren't trained that women present differently than a man having a heart attack most of the time. What else? So medical studies were done primarily in men. Women wait longer in the ER than men. Their wait times are longer statistically, and women are way less likely to be prescribed pain medication than men, or at a lower dose.
And that I didn't realize that one until I remember you saying that at some point, that there has been a study about that.
It's just interestingly fuckery. Like, pisses me. Oh, it's in your head, but like for the men, hey, here's your painkiller.
Yeah, and I think a lot of that comes, like, it's fear-based, because I think there was historically differences in funding for like men and women, and for like drug testing and stuff. But I think also too, there's fear of testing new stuff in women because there's always this fear that it's going to be more complicated because of hormone stuff, or what if they get pregnant, or what if something happens to them as a result of trying this drug that impacts their fertility. Like there's just so many
and
things
we've
that
had like with thalidomide or what was
Mhm.
that? Yeah, there has
Yeah.
been instances, right, where
And it's like, oh, fear. But then we like one thing that often comes up is like for cholesterol lowering medications, like a lot of that data was done on men and then extrapolated to women. So and two, like I recently did some medical education event on menopause, and because historically we used to use hormone replacement therapy all the time. And then there was the Women's Health Initiative, I think like in the late 90s, early 2000s. And then it was like, whoa, hold the phone. Hormones are bad, because they started to see more cardiovascular events in women. And then now, like, so then it was, we just don't do hormone replacement therapy. And one of the things that they talked about when I did that class was how, like, decades ago, we weren't living so much of our lives in menopause. It was kind of like you maybe had a few years of menopause and then that was your life expectancy hundred years ago. And now so much of our lives are hopefully going to be in menopause because we've made so much advances in other healthcare things, and people then are struggling more with menopause symptoms. And
and
then
stress and burnout definitely
yeah,
impacts that and makes it worse. And you're
yeah.
right, life expectancy is longer, so we're suffering for a longer period of time.
And then now too, like they went back and re-examined that study and found more nuances that actually can be helpful to prevent heart disease in women up into a certain age and years after menopause, because the way, I think that all speaks to, men and women are different. The way we get cardiac disease is different than men. It's just we can't be, we're not the same.
Am I being told to pause and not like tear a new one about hormone replacement therapy? Because I completely agree that after the Women's Health Initiative came out in 2002, it was just massive fear. And we know, right, as a well-meaning physician, you are not going to want to do something that increases the risk of a hormone sensitive cancer, increases the risk of a cardiovascular event like a stroke
Yeah.
or a heart attack. You're not going to want to. But then 10 years later in 2012, I think it was like NMAS or something
Yeah.
study. See, I should have looked this up so it sounded like I knew what I was talking about. But we know, like, there's so many nuances to that we know now
Mm-hmm.
that we can safely use hormone replacement therapy. So for example, and this is not a medical lesson, but like synthetic progestins versus progesterone, combination therapy
Yeah.
of estrogen and progesterone, length of use, route of administration. Like there's all of these things that we can use to consider. Like, so for example, we use a bioidentical estrogen that is extremely, extremely safe vaginally when women have like friable tissue. Like when we go through menopause and we have less estrogen, we could have tearing, dryness,
Yeah.
which could be bad for sex. And also some women just are uncomfortable day to day. And this is like
And
life changing for them.
Also has been shown to reduce urinary tract infections when people have treatment of their postmenopausal stuff, like for vaginal dryness and things like that. And I think it's that taking some of that fear away and looking at the data and saying like, we need to do things differently when it comes to women's health.
Completely agree, because we shouldn't have to suffer for, like, just using that example, like you shouldn't have to have painful sex or a dry vagina. if
Or like terrible hot flashes that you can't sleep for decades of your life. Like
Mhm.
that's not ideal.
Yeah. And we see it all the time. Like, I'll have women come to me and initially they're like, no hormone replacement because, heard this, read that, whatever.
Yeah.
And then again, with the way I structure my care and we actually have the time to sit down and have those conversations,
Mm-hmm.
what they need for them based on their blood work and testing and what the actual risk is for the type, dose, route of administration that I'm prescribing, then they're like, oh, okay, I guess I don't need to be
So afraid.
yes, exactly.
Yeah.
Or, what is the risk that I may have a stroke if I'm on this for like more than 5 years
Yeah.
versus I can't sleep, I'm miserable, I
Yeah.
want to commit suicide because my hot flashes are so bad, I'm not sleeping, whatever.
Yeah. Or even too, I was thinking about this before we hopped on this call, like um, women, when they would go into perimenopause and have awful vaginal bleeding and their periods are all over the place. It used to be like, oh, we'll just take out your uterus because that was the only thing that we could offer at that time. But now, like, um, you've seen like lots of people do really well with IUDs or things like that can reduce your bleeding without you having to go through major surgery and all the risks and stuff that come with that. So I think we're definitely making advances,
Yeah.
which is great, which is, I think it's good for the future for sure.
Perimenopause is one of my favorite areas to intervene naturopathically because we can make such a difference in that whole life stage.
Mm-hmm.
Okay, so speaking of fear, how do you think our professions could work better together?
I think it's things like this and having conversations, because we so often we work in silos in medicine. And I think probably like alternative healthcare practitioners are better at working in connection with other healthcare professionals. But then it's like there's this like it's an either or, which it doesn't have to be. And I don't think it should be, because there's certain things, like you said before, that we do that you don't do. And there's a lot of things that you do really well at that we don't really have this space for in the way things are structured, or even to like going into like the depths of like lifestyle stuff. Like I know it to a certain extent, but I'm not the best person for that. And sometimes it's harder to get that access for people.
And I love that you say that and have that understanding and that integrity to say, like, I'm not the best person. And we learn that, like, when is this out of our scope? And we need to refer to
Mm-hmm.
medical care because we will do harm by trying to manage this condition with herbs or
Yeah.
other modalities. Like, we are so clearly trained to know that line,
Yeah.
or like even see that line coming way in advance to not
Right.
do any harm. And we want to ease the burden and do like what we do well. We want
Yeah.
to focus on that, and then by us doing that, we free up the space for you guys to
Mm-hmm.
do what you do really
Yeah.
well. If we could all just, get out of each other's way and put patient care and outcome
Yeah.
first.
Yeah. And I think all like ultimately too, I think we'll see I hope that things will continue to get better, because I think another part of it comes down to how people are able to access healthcare. And I think like we're seeing that people will have more benefits and stuff like that through employers and stuff, because I think historically too, like if you look at, let's say, chronic back pain, like that's one of the major presentations to primary care is back pain. And for a long time, physio was covered, and then they took that away. So really, like if depending on what you have, like it's it's easier to access medications, but maybe there's other things that would be really helpful for you, but it's harder to access. So I'm hopeful with stuff like that, that things
And when you
will
say harder to
improve.
access, what do you mean?
Like if people don't have benefits, it can be easier to access medications and pay for medications than it can be for physio. But because that kind of funding part has gone away. But I think like if we're able to work into more holistic models of care, I think overall we would potentially see benefits in terms of healthcare costs, because people are healthier and happier and not in as much pain.
We know this has been proven, again, another study that I had been examined on, but the whole like ounce of prevention is worth a pound of cure. It's like 10 cents on the dollar that it would cost the government to focus on prevention.
Yeah.
And that would free, so we could help with all the like lifestyle chronic things like that, and then you guys can excel at the acute care and the really good diagnosing and sending people to see exactly who they need to see, with a system that's less clogged up. And I've got mixed opinions, and this is another again a whole other podcast, but I think we have to shift our mindset in a way. Like here in Ontario, we have a publicly funded health system. Other people, like we have people listening from all over the world. It's different in the United States with their private care. But I think with where we're at today, people need to also realize that if they want like to be in the best health, they want energy, thought clarity, their weight's under control, blood work's impeccable, not just fine, like blood work is awesome, then they will have to pay or access alternative services, because that is just the way it is set up right now.
And I totally agree. I think we often have this like mentality when there's public healthcare systems that it's like quote unquote free, but it's not. Like there is a pot of money that the government pays for healthcare, and as much as it's beneficial to put stuff into primary prevention, like there's always going to have to be tertiary care, so like your emergency hospital stuff, and that's always going to be more expensive, and it continues to get more expensive because like everything that's new and coming out and cutting edge, it has cost to it. So I agree. Like I think there's parts where we have to look at what we're doing for ourselves outside of the system.
Because it won't provide it. It won't provide it all. It can't because just the drain on it, the amount that we're expecting a system to do, it can't. And the cool part about what I'm doing, what I want to do is, and when we finally have the numbers and enough people, then it makes sense and it gets more and more cost effective as we go, because we can provide community medicine and resources and give people the access to the information that they need to help themselves be healthier, even if they can't necessarily afford to work with me one-on-one. They can afford to work with me in a group. And then we can make the care accessible for everyone.
Yeah.
Hopefully that's the
And
dream anyway.
Yeah. And I think too, like, one of the things that comes up a lot in your book is like so much of this comes down to like mindset and the stuff that you're doing yourself. And if we can get those types of messages out, I think that really makes a difference. And I've been trying more to integrate those types of things into my day-to-day practice for myself, but as well as like when I'm speaking to other people. But it's hard because the only resource that is so finite that we cannot fix is our time. So and
we need a new model. Let's make it.
We need
together.
A new model.
Come on, come to the dark side. All right. Well, I think we've given like a lot for people to think about.
Yeah, I think so too. This is a great conversation to get to have. It's my first podcasting experience, so this is really fun.
It was so much fun. I'm so grateful to have you on and have your perspective. Oh, and I think some quick tips for us working together. The naturopathic side and the medical side is, better communication, or like maybe physicians knowing that they can access our college's database so they can check and see like, is this person registered, licensed, whatever? Because you guys have the CPSO and I'm on the CPSO looking people up all the time. Like, why don't you guys creep us?
I didn't know there was a creeping.
Oh yeah, I'll send it to you. Send it to your friends. Yeah, our college has a database just like the CPSO has their physician search. You can search us too. Ours is called Kono. Mm-hmm.
Oh, cool.
Yeah, so you can be like, is this person legit or not?
Yes.
And you just do it in the appointment. They don't even know what you're doing.
And it is, I think too, like, I think the professionals themselves coming together and speaking or having some sort of dialogue, whether that's by letter or phone or whatnot, because often too, I find sometimes it's when we're hearing it from multiple different people, like there's that message gets lost in translation when it's coming between, and something professional to professional is always helpful.
Yes, I think that is actually the best thing, because I forgot about this. Sometimes the message gets lost in translation through the patient.
Yes.
Because then we get it and you get it. And I'm sure patients will come to us and they'll be like, my doctor said, and in receiving that, it's like, what physician said that? But like, and vice versa, right? Like, my naturopath said this or that, but like without the clinical rationale and, understanding the whole thing or where we're coming from, or, sometimes things were misunderstood. Like, we're human. We hear things wrong sometimes, or I'll have a patient come back and be like, oh yeah, well, I told my doctor. I mean, this might happen like once in like out of thousands and thousands of appointments, but they'll be like, oh yeah, well, I told my doctor you said this. And I was like, that was like a 10th of the whole point.
What I hope that, yeah. And then I think like when that communication isn't clearly happening, that's when it all falls off the rails.
That breakdown. So I think, from our side of things, and at the beginning of my career, I would write letters, I would send faxes, I would send PubMed abstracts to justify my treatment plan. And I did this all unpaid on my own time. And a lot of times the physician wouldn't even read it. I was like, hey, they're busy. I know they're busy. They're overworked. Here's like on a silver platter, just, it's a page and a half, like just read it. Like, cause then you don't have to go on PubMed to believe me. And half the time it would get a couple times I had patients say like, they literally took it and threw it in the trash. So I was doing like, that would probably take me 45 minutes a patient, an hour a
Right.
patient to write the letter and do the PubMed stuff. So then I stopped.
Yeah.
Right. And, and because how's that sustainable? If you try and do that for every patient and not get paid, like it's not sustainable.
Yeah.
So
and
I definitely think the communication is a big piece.
It's a big piece for sure.
Thank you so much for being here and sharing your insight. Hopefully we can do a follow-up in a few months with some updates and how we've continued to work together to change things and make it better for women physicians and better for our patients collectively.
Yes, absolutely.
All right.
Thank you for having me.
Thank you for being here. Have a great week, everybody. If you like what you heard in this episode, leave me a rating. Your support helps me get discovered by more women like you. Together, we can change the conversation around women's sexual health and pleasure for you, your partners, and generations to come.